Okay, so we have started the recording as well, and then we are good to go with the start. Yeah. Good morning, good evening. Welcome to all the amazing nurses joining us today. A happy International Nurses Day to all of you, first of all. Today, we are super thrilled to have you all with us on this special day of the State of World Nursing Report launch event. It's a huge, it's a big moment for the Eastern Mediterranean region because around 19 countries, 77 organizations, and 22,264 members are and more nurses are joining hands together to have a united call. It's an immense pleasure to have our nurses from different countries across the Eastern Mediterranean region. Before moving to the main part of the webinar, I would like to share a few housekeeping messages with you all. Please use the chat box to introduce yourself. Where are you from? What is your role and your name? You can use the Q&A box to ask any questions from the speakers. And by the end of the webinar, we will definitely, if we get time, we will be asking from our speakers. The session is being recorded and it will be available at the Nursing Now Challenge YouTube channel as safe. If you need to use translation function, please click the CC icon below and choose a language. Remember that WHO official launch of the SoWN report is today at 1 p.m. CET. We will share the link in the chat box. Don't forget to register for that as well. So we are now officially starting our webinar, and we are getting started now with our first esteemed keynote speaker of the day, Dr. Gülin Gedik, to share the key findings of the State of World Nursing Report 2025. Dr. Gülin is currently Coordinator Health Workforce Development in the WHO Regional Office for the Eastern Mediterranean region. We are honored to have you with us, Dr. Gülin. Over to you, please.
Thank you. Thank you very much, Shazia. And let me just share my screen with you. Okay. Thank you. Thank you very much. It is my pleasure and honor to join today to this webinar, and thank you for kind invitation. Dear colleagues, dear friends, happy Nurses Day. And also we are very pleased. Today we are launching the second State of World Nursing Report, which is following the one in 2020. This provides us some new information, new evidence, which can guide our actions. So I'll try to give a few highlights from the report in the coming few minutes. This report gave us a good understanding of the current situation. And we are very pleased to see the increase in the global numbers, which increased from 28 million to 30 million in the last 5 years. And the nursing density increased to 37.1 nurses per 10,000 from 35.5. However, the shortages continue to be around 5.8 million, and also we still face inequalities in distribution. 78% of nurses are serving to the 49% of the population. Nurse density in the European region is 5 times higher than African region and Eastern Mediterranean region. And if we look at the numbers in our region, yes, we have witnessed an increase from 1.1 million to 1.3 million over the 5 years. but we still account only 4% of the global nursing stock. And our density remains at the level of 15.5 per 10,000, which is almost less than half of the global average. And also, we witness great variations between 1.2 per 10,000 in some countries up to 80 per 10,000. And while we are facing these shortages, we also see that there is a gap in the production capacities. The mean number of nursing graduates per 100 active nurses is 5.6 in our region, against the 6.4 global average, and the same with the number of nurse graduates per 100,000 population, which is almost the lowest with 9 across the globe. So I think we need to do a lot. And when we project for the future, we can see that there will be an increase to 36 million in the global stock. And Southeast Asia will contribute to that increase by 30%. And if we don't take any action, it is expected our contribution from our region will be only 3%. And global density will rise to 42% per 10,000 population, and estimated shortages is expected to go down to 4.1 million. However, African region and Eastern Mediterranean region will account for 75% of this shortage, and our region will account for 1/4 of this shortage. And also we see that 19% of nurses currently are aged 55 and above globally. What does this mean? In the next 5 years, we will need 3.1 million nurses to replace them when they retire. And also, the global average of nurses under 35 is around 33%. This figure goes 45% in our region. So we have a great potential of young nurses in our region for future, for our future leaders, but at the same time for global workforce. And I'm sure you all are aware of the policy priorities of the global strategic directions of nursing and midwifery, which emphasize creating jobs for nurses and strategies to attract, recruit, and retain them, optimizing the domestic production capacities with appropriate competencies, strengthening nursing regulation, and protecting and safeguarding our nursing workforce, and also investing in nursing leadership. So the report showed us these strategic directions still remain valid. That's why next week it is proposed to World Health Assembly to extend the duration and validity of these strategic directions up to 2030. However, the report also highlighted some emerging priorities. I think there has been emphasis the need to develop advanced practice nursing roles, and we had a webinar in our region this morning where it was highly emphasized and highlighted. And also, we know that 80% of the global nursing workforce is female, and this is 73% in our region. So This really raises the importance of ensuring gender-related, gender-responsive policies, appropriate pay mechanisms, and working environments and conditions. And also, we all witness rapid increase in the digital tools and technologies, which impact the practice and education of nursing workforce, which really needs to be harnessed and taken into consideration. And also, nurses can contribute to the climate agenda through their education, advocacy, and climate conscious practice in health settings. And we really need to empower nurses to enable for their contribution. And in the Eastern Mediterranean, this came out from the report, but this is very much relevant to our region. We need to provide tailored support for nursing workforce in the fragile, conflict-affected, and vulnerable settings with a special attention. And it is clear that all policy priorities and related actions will need to be supported by targeted investments and country-level collaboration. And this is very much in line with the regional flagship initiatives on investing in a resilient and sustainable health workforce. So we believe together we can achieve a lot through investing in empowering and protecting our nurses, our health workforce for now and for the future. Thank you very much. Happy International Nurses Day.
Thank you so much, Dr. Gülin, for such an insightful talk. And you have rightly mentioned that the need of the time, and as you specified, the need of nurses to be empowered by engaging in collaboration, by engaging in different activities and improving the state of nursing. It's really important, and I hope that our audience have really benefited from your speech today. Next up, we have Ms. Mariam Nooh Al-Mutawa, Chief Nursing Officer at Hamad Medical Corporation. Ms. Mariam has been a valued member of the HMC since 1998. She manages a multi-workforce of around 11,600 nurses and midwives in HMC Qatar. Ms. Mariam is going to be sharing implementations and recommendations of report. Over to you, Ms. Mariam.
Hi, Assalamu alaikum, good morning. Hi, everyone, you can hear me?
Yes, Ms. Mariam, we can hear you.
You can see my slides?
Yeah, we can definitely see your slides.
Excellent, thank you. I'm so sorry because I have technical issues. Thank you for having me today, and happy International Nurses Day. And in Qatar, we are celebrating both the International Nurses Day and Midwifery Day. So thank you for this opportunity. And I'm going to share with you a very high-level presentation. So we'll be talking about the findings in relation to our stakeholders. And it's very crucial for us to understand how the stakeholders' engagement with us and how we can influence this as nursing workforce. So we'll be talking briefly about, because of the timing, I have 10 minutes only, to be honest with you. So we'll be going to talk about the Education Institute, regulatory bodies, the government members, nursing association, labor unions, nurses, employee health facility, research, and our nurses for sure, and civil society, and the Minister of Health and the workforce planners. So to start with, the government member states, and they have a specific key implementation. I will not going to talk about the implication and details, but I'm going to show you in the same slides, if you don't mind, because of the timing, the implication as well as some of the suggested action. And if we look to the government member state, it's very crucial for us to look to the government, and we must take leadership role in ensuring a well-supported, protected, adequate, staffed health workforce by investing in education, the workforce protection, the mental health, and internal cooperation, and ensure resilient health system providing equitable and high quality care. And why this is very important? Because we have really to invest in our future generation to come and to build the capacity. So that's why we need the National Government Institute to help and support us by fundraising and increase nursing education capacity. And for sure, looking to the recruitment and retention policy, as well as advance evidence-based and legislation and policy to oversee the implementation and monitoring and accountability. Moving to the second stakeholder, for sure, it's very important for us, the Ministry of Health and the workforce planners, because it's very strategic for us to think from the regional perspective, as Dr. Gülin was presenting to us, the percentage and the senior population that we have within the nursing workforce. So as you can see, some of the suggested plans as well. So the workforce planners must implement the data-driven data, as Dr. Gülin was showing to us, the data about our the age category between our workforce, because you can see that we have the beginners or the young generation and you have the seniors. So if the seniors will be retiring, this will affect our workforce and how we'll have the educators, the trainer, the clinical instructor to help and support in that perspective. So we have to ensure that we have sustainable workforce policy to address the shortages that we have, to improve the distribution among all the region, and to ensure a resilient health workforce. And we have to focus on building the capacity and the national level, because you can see that some of the countries, they have a lot of huge number of immigrant staff that they're looking for future opportunity. So we have to look to the labor market and to have the balance between the supply and demand in every country. We have to look to the job creation when we have graduate on the ground, and truly to implement the right retention strategy as well. Moving to the Educational Institute, and they have a crucial role with us to help and support nursing workforce. So our educational stakeholders from education perspective, they have to provide proactive steps to address the faculty shortage, as I said, due to aging or retirement staff, and to have really the technology, as all of us know that AI invading even the practice. I don't know if you heard about the new hospital that opened in China, dealing with 3,000 patients without physician. So you can imagine how technology and AI will interfere and support. For me, I see that it will be supporting our nurses in the ground. So how this is a new technology will help and support our education, how we'll be able really to enhance the student experience by really using this technology, and how we can influence our stakeholders in the ground to help and support in this journey, as well to address all the bottlenecks in our education, the numbers of years, the quality of the educators, the clinical skills, ensuring that our curriculum align with our needs at the country level, not competing with the global market, but to see every country have the unique community and what we require in the country. So this will be a huge uh, agenda for us to focus at the country levels and maybe in the regional level as well. Moving for you and all of us in the session about our regulatory bodies. So it's very important for us that we have our regulatory bodies in the ground. So the regulatory bodies in our countries, they ensure that we have the right scope, the right standard, the licenses as well. And this will strengthen our voice in the community, the strength our role as well as leaders and as a stakeholder working together. So by updating our regulation, because we cannot send policy or regulation for a longer period of time, Our career is evolving, the nursing practice is evolving, our research, our education. So we cannot keep the regulation for a long period of time without update, without review. That's working with our regulatory body and our country level that help and support us, because it involves a lot of things like a continuous nursing education, advanced practice. So we have really to help and support this journey for advanced nurse practitioners, how we can really emphasize this when it comes to advancing nursing practice. If we talk about our nursing association and how really we can collaborate at the country level and globally under the partnership with the ICN as well, how our country can help and support us in this perspective, how our professional association can support and the stronger workforce, how to protect our leadership, how again to contribute to the advanced practitioner nurses development, how they play a great role in the government advocating for education, for the regulation, for safeguard our workforce. When we talk about it, we talk about all the speciality. We talk about males and females. We talk about our education and really ensuring the standard and the practice. So for us, the Nursing Association play a great role advocating for the fair wages, for example, the safe working condition, a healthy work environment, the staff well-being. So it's very important for us to work closely with our Nursing Association. Moving to the labor unions as well. It's very important because they are very crucial. I know that it's not implemented in all the countries, but in the countries they are exist, they are very, very important, helping supporting our nursing workforce in the ground, and they are advocating for their well-being and advancing their practice as well. So moving to our nurses, employee and the health facilities, it's very important for us because we have to think about the opportunities when we talk about leadership development, when we talk about advanced practice, engaging the leaders and the policymaker, advocating for our staff in different settings. So when we talk about it, that include private and governmental sector. So when we talk about it, we talk about the holistic nursing workforce in the country. That's why it's very, very important to look about this opportunities and how we can help and support our staff in the ground. Moving to the other opportunity when we talk about research. So all of us in the call looking for the evidence-based practice and how we encourage the research, how we can support our researchers in the ground. So how we can ensure the translation of the research and the evidence-based practice, how we can do this and the new generation as well to come, how we can protect the time for nurses to contribute to research activity as well, because it's evolving area and we have a lot of young generation and even our seniors who's really interested in research. So how we can work together with our stakeholders to involve this and really to support this journey for research, because we can see the outcome. We can see during COVID experience, for example, how the research helped us a lot. If we talk about the staff burnout, if we talk about opportunities, staff well-being, mental health. So all this was so evident during the COVID time, and it was excellent experience for all of us in the ground. So if we talk about our nurses, for sure, they are struggling. If we talk about the young generation, because we extended the retirement age, we keep the seniors in the ground. So we have a lot of graduates who cannot have job opportunity to be recruited. So when we think about education and training and graduate, as again, as I said, looking about the current demand in the system, and we have those graduates, how at the region, this is my humble suggestion that we can have a recruitment strategy in the region so we can help each other in this perspective and help our young generation to be recruited, because we depend on them, because they are really working between the medical social community as well, as we agree that our nurses, our future, and we have to build the capacity as well in the community. So how really we can support this with working with different stakeholders in the ground to help our young generation. If we talk about the civil society and patient advocacy group, I know it's evolving in our country and in the region, But if we talk about the whole experience, focusing in the person-centered care, looking to different opportunity to really have the right team members and the patient voice to be heard. If we talk about governmental hospital or private, how we can strengthen the patient advocacy group to work and support us. They are shaping our practice. They are giving us a lot of ideas to really change in the daily activity. So we have to emphasize about this contribution and to promote health equity for our patient-centered care. And I completely appreciate that some of us in the call, they have, for example, Plan 3 accreditation, thinking about accountability of our workforce and commitment toward those patient advocate groups. So this is all briefly concluding my presentation, and thank you for listening, team.
Thank you so much, Ms. Mariam, for these insightful remarks and recommendations that you shared. It was really insightful and thought provoking. As you talk about, the recommendations from education level to healthcare sector level, and how we can, shape policy which is data driven, and how important it is to focus on the nursing education research. So I think most of you, can relate to how it is important for us, even from a student to a nurse leader. It's an evolving journey. So thank you so much, Ms. Mariam, once again. Moving on further, as we might have student nurses and early career nurses with us today as participants, as we know that we can definitely relate to the roller coaster of experiences we go through from being a student to transition to a professional by becoming an early career nurse. And it's definitely a challenging as well as a transformative journey. Um, so we also believe in the power of student and early career nurses' voice and their ability to drive change. So today we have with us Atika Shah. She is a final year nursing student at Ziauddin University, Karachi, Pakistan. She's also a member of Nursing Now Challenge Eastern Mediterranean region. Atika Shah is going to share the State of World Nursing report through the eye of a nursing student. Over to you, Atika Shah.
Thank you, Shazia. Thank you for such a nice introduction. And thank you, Nursing Now Challenge, for this opportunity to share my thoughts and contribute to this amazing conversation. As a nursing student, I'm excited to leverage this platform to amplify our voices and contributions. We stand at the threshold of our careers, ready to make a meaningful impact and support the advocacy efforts outlined in the SoWN report. 4 years back, when I chose nursing as a profession, I faced numerous prejudices. Always wondered if I would have a respected and valued future and whether I would make the most out of this profession. But today, I want to go back to old me to tell that yes, we did. I have not only proven those doubts wrong, but also made most out of this journey. Nursing has opened doors to incredible opportunities, enabling me to expand my reach globally. I have had the chance to work internationally, participate in global organizations, and attend international conferences as well. It also enabled me to explore different aspects of nursing profession that needed new ideas and more attention. If we talk about SoWN report, it contains incredible information. It highlights where and how many nurses are there around the globe. Every individual country with the involvement of their nurses contributes to this report. It actually offers a broader perspective of the nursing workforce at global, regional, and country level. It also highlights the contributions of nurses in achieving sustainable developmental goals, including health, education, and gender equality. The SoWN report is a valuable resource for understanding the current state of nurses and their role in global health efforts. This report is by nurses, but not only for nurses, but also for those who are involved in healthcare policy, including policymakers, stakeholders, or the global health community. As a student nurse, we play a vital role in shaping healthcare's future because we are the futures of healthcare. The SoWN report highlights the importance of investing in education and leadership development, aligning with Nursing Now's goals. According to a research in Spain back in 2020 shows that up to 70% of nursing students experience anxiety during clinical placements, emphasizing the need for supportive learning environments. If we talk about Emerald region, in the Emerald region, significant investments have been made in nursing education, with countries like Saudi Arabia allocating substantial funds to develop nursing workforce capacity. In Pakistan, Aga Khan University's Advanced Practice Nursing Program, it focuses on developing advanced practice nurses who can manage preventive and non-communicable diseases, reducing healthcare burdens. By investing in nursing education and adhering to SoWN recommendations, we can strengthen the body of student nurses. For instance, according to the SoWN 2020 report, investing in nursing education can help the global shortage of nurses, can address to, like the global shortage of nurses projected to reach 18 million by 2030. By prioritizing nursing education and leadership development, we can enhance patient care, improve health outcomes, and empower the next generations of nurses to drive positive change in healthcare. Thank you, and a happy Nurses Day.
Thank you so much, Atika, for such an insightful speech. Next up, we have Sumaira Shaheen. Sumaira is an early career nurse from a graduate of Al Khan University School of Nursing. She's also a member of Nursing Now Talent Committee. Ms. Sumaira is going to be talking about the role of early career nurse through NI of an early career nurse, the SOWN report. Over to you, Sumaira.
Thank you so much, Azia. And thank you to the MRO Hub leads for granting us this platform to raise our voices. This is indeed a valuable opportunity to recognize the potential of early career nurses in supporting the advocacy and impact of the State of the World's Nursing Report. Today, I represent the many capable yet naive nurses who, despite their knowledge and skills, stand at a delicate transition point where a single push can either propel them forward or cause them to retreat. The transition into professional practice itself is a challenge for us early career nurses, which includes navigating a new identity, fitting in the workplace, collaborating with seasoned professionals, and sometimes the dilemma between choosing passion and career scope, specifically in developing countries like Pakistan. And if this transition is not supported, we risk losing them from the profession, thereby leading to a high turnover and threatening the future of our nursing workforce. Hence, I believe it is the need of the time for a strong support to these early career nurses while they go through this professional roller coaster. Now, as an early career nurse, this support serves as a roadmap. It offers validation and direction to confirm that nurses like me, who are new, motivated, and eager to grow, are valued in healthcare. It basically helps us to understand the global context of our profession, showing that the challenges we face locally are often shared worldwide, and that our role is part of a much bigger mission. Looking into the past, the 2020 State of the World's Nursing Report basically revealed that in the Eastern Mediterranean region, the nurse density was included among the lowest. It was reported to be just 7.1 per 100,000 people. While it addressed the workforce inflows and outflows and nursing education, it lacked guidance on easing the transition for early career nurses. And today, I believe, is a key opportunity to re-emphasize stronger support to early career nurses and advocate for a standardized, global, uniform preceptorship model that supports new nurses as they adapt to their professional practice. Now, with regards to the advocacy for this report, we need to serve as a bridge between the report's global vision and our localities. Initiatives like the Nursing Now Challenge serve the opportunity to connect with peers from around the world who are equally committed to transforming the future of nursing. Global networks like the NNC has empowered me and many others to share knowledge, to build leadership skills, and see that while our local realities differ, our goal remains the same, which is to elevate the nursing profession and improve health systems everywhere. Today, the State of the World Nursing Report provides the evidence, and organizations like Nursing Now Challenge help us turn that evidence into action. In the end, we need to re-emphasize that the care early career nurses give begins with the care they receive. Thank you so much.
Thank you so much, Mira, for sharing such amazing, insightful thoughts. And definitely, our audience can, relate. Either they are student nurses or early career nurses. They can relate to how important it is to have, spotlight or highlight of the things that are going on. These are amazing insights from you guys. Thank you so much. So while heading to the closing remarks of today's webinar, we have with us Professor Ruwaida Al-Mutawa. Professor Ruwaida is a former senator and Minister of Higher Education, Jordan. We are so honored to have you with us, Professor Mehta. Over to you, please.
Thank you so much, and happy International Nurses Day. So before, I reflect on the, some points that was mentioned, were mentioned, by everybody, I think. I will just, tell the young nurses, those, across the Eastern Mediterranean region, that you are not merely the future. You are the voice, the innovation, and the driving force needed today and tomorrow. I would like to tell you that, the SoWN 2025 report reflects your challenges and amplifies your potential. It reminds the world that nurses are the backbone of health systems, and youth nurses must be empowered to lead for now and for the future. Also, I would like to say that to health leaders and academia, as well as, the service provider, invest in youth nurses. We must do that. They are, the majority of our nursing community. We need to transform education. We need to ensure fair pay and safety for them. We need to foster leadership pipelines and build systems that retain and respect talent. Respect talent, respect talent. This is your moment. I'm talking to the youth and all nurses, of course. Let this generation of nurses redefine what health systems can be: equitable, resilient, and led by those closest to care. So let history record this moment, not as celebration, but as a turning point for all of us. And remember all the time that you are a significant economic power, not only in the region, but in this world. But I would like also to reflect on three important issues, because many issues were raised by the speakers. The one is about the advanced nursing practice. Because of the shortage that we have, the severe shortage that we have in this region, we have to change our way of doing things. If we institutionalize and if we regulate the advanced nursing practice, and if we give it the right legal framework, then nurses can be recruited much easier to the nursing community. Because we don't want nurses in many of our region is to, when they get their PhD and their masters, to be the same as staff nurses. Of course, we are all staff nurses, but it's good when they are specialists and when they are specialized in some domains, we have to say that they have to work with something saying that he is specialist in this area. So this is very important to establish the legal framework for advanced nursing practice here, and we have to work this together. Also, we have to integrate, to invest better in nurses, as well as to integrate in our education system more about the social determinants of health. Actually, the reports say that, we don't have much, in this region. It's actually zero, maybe it was reported zero in this region. Also, the climate, also, we need to talk more about the health diplomacy also, as well as the negotiation skills and policy influence. We need also to, because, the the advanced nursing grow again, uh, we have 61% of our nurses in this region, and it's the highest actually expats. So I think that, the region should produce more and more to have, more nurses. They have to find, some ways that, they are different, that what we're doing. Maybe the payment, maybe the decent environment, and the decent, working condition, will be, evaluated, as well as, the leadership programs that we provide also should be evaluated by now and monitored. Also, we need to strengthen and give a priority to accelerate the growth in demand for nursing jobs in the EMR, as well as to strengthen regulation, ensure decent work condition, and enforce accreditation and CPD standards. The other thing that, that was mentioned actually by speakers is to strengthen data system for real-time workforce monitoring and forecasting. And actually, one of the things that I like is, the focus on the importance of mentorship, and we need to expand actually mentorship and career ladder for youth, as well as, for nurse leaders. And we need to fund leadership pathways in a better way. And finally, I would like actually to congratulate and say many thanks for the Bird Trust for Nursing Leadership, the board members, leaders, and family of the Nursing Now Challenge, and also Dr. Gülin and the speakers, Dr. Mariam, and, all beauty speakers, as well as the regional hub leads and members, as well as, the challengers and the challengers committee and all nurses that we have. And for the team, thank you so much. You're doing excellent job. And we hope that, we always celebrate, not only just for celebrate, but to move forward. Thank you so much.
Thank you so much, Professor Ruveda, for such a wonderful talk. And we really appreciate, the efforts, the tireless effort that you for the improving the quality of nursing education and much more. Um, so coming to the conclusion, so we can also see that there is a very interesting shade going on in the chat box. People are sharing their ideas and their reflections, and these are really thought-provoking discussions. So this is our moment. I think this is the high time that we unite together, network across the region, engage in discussions, potential discussions like this, and bring forward possible solutions to improve the quality of nursing workforce, and either from the very basic education level to the working environment in healthcare sectors. And I strongly believe that these such type of discussion create avenues for these recommendations. So thank you so much once again for all of our speakers for this brilliant and amazing, insightful discussion. Now we are moving toward the question and answer session. So if the participants do have any questions, please drop it in the Q&A box. By taking care of the time, we will be asking from our speakers. So I believe we have a question from Tasneem Ali from Jordan. So Tasneem have a question that what are the proposed strategies to reduce the migration of nursing staff from countries with limited resources? It's an amazing question, Tasneem. Thank you so much for asking. So any speaker want to take up this question, please? Yeah, so Dr. Mariam, Ms. Mariam, Professor Ruveda, Dr. Gedik, or any of the speaker, if you want to take up this question, please.
Sure, thank you. I was trying to open my mic. So, looking to the report, to be honest with you, I wanted to say this comment without even listening to the question. So, we have a great action that it's very detailed, and I can assure anyone in the session today or beyond the session that they give us the action that we can work with our stakeholders. I was referring to give us the opportunity to do it different place. Okay, so with the current challenges, as I said, if we have the right, recruitment strategy, retention strategy, if really we increase the salary wages for the nurses, if we have equal opportunity, if we make it better health work environment, all of this will help our nurses to return our home country. We'll not have this migration happening within a nursing workforce. Why they are leaving? Because they are not happy, they are not satisfied, they don't feel that they are secured, they don't feel that we are advocating for them. So I'm so optimistic about this report, to be honest with you. Back to Dr. Gülin when she said there will be a recommendation to expand it to 2030. I was so happy listening to that, because really this will help us a lot. If we talk about education, if we talk about recruitment, if we talk about our staff well-being, the report will help a lot to enable us with our stakeholders, and every single country are working together at the regional level. That will make a huge difference for our staff. So I can see that I'm not only so optimistic, but I enjoy reading the report. And honestly, there is a lot of action that easy can be implemented. And always I'm encouraging the generation to come and the current generation to speak up, because they were able to influence the policymakers. They were able us to change things in practice and policy and things that we are doing, from education, from training, from leadership. So we need those amazing, talented generation, and the young generation to come. The student opinion, very important for us to listen to. So when they speak up, we'll be able to change, we'll be able to advance their experience. But they have to speak up. We have to hear their voice. I was in a session early this morning and I was telling the team, don't talk to each other, talk to your leaders, speak up. This is your right. We are here to hear your voice, and your voice matters to us. Thank you.
Thank you so much, Ms. Mariam. I think this is so insightful. I hope it's gonna answer your question. Any other speaker have any take on this? Or yeah, so I don't think that we have more questions in the chat box. So it's really lovely to have you all. We have 10 more minutes. If anybody else have any questions, please drop in the Q&A session box, because it's an incredible platform, and it's an opportunity for you to interact with very inspiring speakers we have with us. They are well experienced and they have seen so many things, and they're always here to help us out. So if you have any questions, we have 10 more minutes to go. Please feel free to drop in the chat box. Okay.
Fezia, may I say something?
Yes, please.
Because we are together, and of course, today I think you will get the report. Every one of us will get it. We have a report that we cannot use right now, but we can give the information. But I would like to call all nurses to tell them, if you can send for you the priorities, what are the priorities that they think is important for them. So some from region X will say yes, some from country X will say yes, country A will say yes. So it's nice to send us the priority for the countries. Then we will have something from this meeting. They can send it to you, at least like two priorities for all, and then we bring it together and we see what are the priorities. This is one action. Also, maybe it will enrich future webinars and future workshops. And thank you, Dr. Mariam, Dr. Gülin, and every single person for the great presentations. Thank you. It's super. Thank you.
Thank you so much, Professor Ruveda. I think this is a good idea, because it's a very important step to just start the discussion, just start the momentum, and we can definitely do that. As Professor Ruveda said, we have to go through the report. So one time, two times, three times, as far as you can understand the crux of the report, you must go through it. As we have 10 more minutes, so if nobody has any question, I do have a question, because I really believe that student nurses and early career nurses are a very potential part of the nursing structure, because when we are a nursing student, then we have lots of questions in our mind that why this is happening, why this is not happening, and we try to we try to challenge the status quo sometimes, to have better options. And when we transition to early career nurse, as Mira Shahin also and Atika shared their experiences, that it's a very different structure that we get to see, that things are in a very different momentum going on. So it's my question to Ms. Mariam, Dr. Gülin, or Professor Ruveda, or any of the speaker, if they want to take on this, that how important it is, to help the nursing students, how important it is to invest in the nursing education, so that when they move to their early career nursing, or when they move to the leadership ahead, they are prepared enough and well informed that this is the state of the nursing, and we are capable of doing it. Because sometimes we used to question our own capacity or capability, that we won't be able to do it. Because and I think that training can be given in the nursing education, nursing schools. So what kind of investment we can bring in, so that when they move forward, they are really confident and empowered enough to take action, either in policy, shaping policy, or nursing leadership. Thank you.
May I start, please, with this, because
Yes, yes,
my part.
Professor. Yeah.
I think we have to change, the narrative. The way we teach our students is always that, me, I'm a leader, I'm your instructor, and you are the followers. We have to change that. We have to be facilitators, and that's, the new merit of education. You facilitate and they lead. We have to start from there in order to do the transformation, in a nice and soft way, into any other, area that they want to go to. I think, in the through education, we have to empower them. We have to tell them that, yes, the patient is the center of our care, yes, but also you are the center of the world. You are the economic power in the world, in this world. We should not always say that, within patients, we are not dealing only with patients. We are also dealing with the wellness as well as the illness, of course, and the prevention and some other. So we have to emphasize, their role in the economic growth in their country, their role in improving, the lifestyles of people, and, the value of care, that they are doing. And I think one of the, I think last year, the IND report, it was about, the value of care of nurses. So we have to tell them, how important are they? How important they are, one of the main pillars in their countries. They are as important as any politician, in the country, in moving, forward, for the best of their country and the best of their people. This is the thing that we have to remind them all the time. We have to empower them. We have to show them you are strong and you are important for us and for the world. Thank you.
Thank you, Prof. Shazi. Can I add something?
Thank you so much, Professor
So-
Ruveda. Yes, Mariam, please.
Thank you, Prof. Ruwaida. So I completely agree with you, and always I'm telling them, you don't have to have a promotion or title to be a leader. You are a leader at the bedside. You should not have promotion to be a leader. You are already existed leader with us, because they are leading the patient care. They are advocating for the patients. They are more, engaged with the patient's needs, with their family. We are there 24/7, with my respect to our colleagues. Like a physician will come for round, put order and leaves. But we are there We are there, available all the time for them. And I'll give you a quick example. So we have our graduates who come from the university to work with us. We change completely our general nursing orientation when we listen to them, how it's going. We ask for their feedback because we want to make it very convenient for them to match their expectation, to make it easy for them. The majority of us in the call really struggle when we were younger. So we are here in a position to make it easier for them. We are here to really build the capacity in our country, in our community. So we have to facilitate this journey and the experience to make it easier for them. We have to listen to their concern because that's why we are in this position. Not because we have titles, not because we have authority. We are here because of them, because we are responsible about them, about their journey as well. Because later on, they will be leading the journey. They are already started the journey. Once they are joining the nursing education, they are there. They are in the in the profession. So we have to make it easier for them. From my perspective, it's the leaders who make it easier for them, from the charge nurses in the unit, from the unit manager or the head nurses. So every one of us responsible, every single staff nurse or even student, they are responsible already, because if they hear something they don't accept, or attitude or behavior or information, they have to speak up. They have to advocate for themselves, for their patient, for colleagues. Even as a student, they have to speak up to let us know what they need with this competing, activity happening around them, with the different demand, with the speed of the life that we are facing right now with the technology, advanced technology. So they have to advise us. We should not advise them, to be honest with you. They have to advise us how we can make it different for them, for our patient, and for ourselves as well. Thank you.
Thank you so much, Ms. Mariam. Yeah, so Dr. Gülin, do you have any take on this?
Yes, thank you very much. Thank you, Shadia, for this question, which is very much our to the hearts of us. As you know, our regional director introduced a flagship initiative on health workforce. And it is about investing in a resilient and sustainable health workforce. And our health workforce is the one who start from the day they start their education in health professions. So we consider investing in health workforce from the day they start their education, which is very critical. And one of the action areas in the flagship initiative is making investments in a sustainable way so we can build a fit for future health workforce. So actually today, in the EMRO webinar, we had colleagues from WHO Youth Council who joined us in Cairo in our regional office, and we were having discussions with them after the webinar. And one thing which we realized, the time is changing, the requirements for future is changing, and the competencies required for the new generation of nurses is changing. So we really have to look at what is needed, what type of competencies are needed, and these competencies encompasses many other new skills to respond to the needs. And I think that's where we really have to invest in to be able to enable and empower our future nurses to respond to future needs, which I'm not only referring to the needs of health services, but needs of the health sector, health profession, nursing profession, to take the leadership and to take this area, this sector forward. Thank you very much.
Thank you, Dr. Gülin. This is, so powerful, and I hope that it has, benefits our audience too. Atika and Sumaira, Shaheen, do you have any take on this or any reflection? Because we are just left with 1 minute and we are done with our webinar.
Yeah, no, I just want to add up that as I mentioned in my talk that the model of preceptorship works very well, and it's very helpful for the nursing students and for the early career nurses. And there are institutions, for instance, our institution in Pakistan, the Al Khan University, which implements this model. And if this is made uniform globally, it might prove beneficial for those who are struggling to, enter the professional practice. So that's just I wanted to add.
That's a good addition, Samira. Thank you so much. So we are officially towards the closing of our webinar. Thank you so much for all our esteemed speaker, Dr. Gülin, Professor Ruveda, Miss Mariam, Atika Shah, Samira Shaheen. You have been really amazing, and this webinar couldn't be possible without you and your insights and all the potential information that you have shared must have benefited all of our audience. So thank you so much. Happy International Nurses Day to all once again. Have a good day.
Thank you.
Thank you so much.
Thank you so much.